Are you currently suffering from shoulder pain and were told that it was due to a rotator cuff tear? Hey everyone, this is Dr. Zach Green here at Performance Sport and Spine. In today's video, we'll be discussing rotator cuff tears, everything from best exercise to when surgery is needed. The rotator cuff is comprised of four separate muscles: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. And then these muscles work as a group to rotate, lift, and then dynamically stabilize the shoulder joint. So what does this condition feel like? Well, it typically presents as shoulder pain with a loss of power or function, and this is made more notable in overhead movements or daily activities that are more shoulder specific. And probably the most important part of this whole presentation or video is thinking of a rotator cuff tear as a cut of a blanket rather than a string. So if you think of a string getting cut, it pretty much ruptures and the integrity is lost. If you have a blanket on the other hand and you cut 20% of your blanket, it's still pretty much a blanket. So again, this rotator cuff is much more like a blanket structure than a string structure. If you please like our video, subscribe to our channel, and then don't forget to turn on notifications. What causes rotator cuff tears? So older age, that's the largest factor. Being overweight, smoking, the dominant arm is more likely to be affected, hypertension, and the traumatic event such as a fall or dislocation. With these tears, it's often subgrouped into two different groups where there's degenerative and traumatic. The problem is it's actually very hard to distinguish between the two in most of the cases. And the issue is if you have a traumatic tear, then surgery is probably going to be the choice of action when it maybe is degenerative. So if you have a sudden trauma, you're under the age of 40 and you have profound weakness, it's probably more likely to be traumatic. But this is approximately only about 10% of the cases. So often it's best to think degenerative until proven otherwise. It's always important to look at the prevalence of these abnormalities in the general population. And this study looked at people with and without shoulder pain. And if you look at this chart right here, they found that the overall prevalence for abnormalities in people in their 20s was about 9%. And this increased to people in their 80s of having 62%. So you can see as people get older, these abnormalities just increase as a function of age and time. So you've probably seen a picture of the rotator cuff on the left here. But the thing is, these look like tendons or strings that are kind of independent of each other. If you look on the right of this cadaver model, you can see that the tendons are more interconnected and act more like sheets or overlapping structures. And now we'll cover the exercise or rehabilitation portion of this video. Often we recommend starting with isometrics and then progressing. We'll go over 4 different groups of exercises: pushing, pulling, lifting, and rotation, and we'll give you level 1 to level 4. Well, level 1 is the easiest and progressing to level 4, which is the most challenging. Select one from each group and progress independently. So if you do level 1 with a push and you can do level 2 with a pull, that's fine, but again, independently progress them as your symptoms allow. Banded external rotation isometric. So holding a band with one arm, bend your elbow to 90 and place a washcloth between your elbow and your rib cage. Using your shoulder joint, rotate your arm externally and hold to tolerance. Work up to doing 2 sets for 30 seconds. Banded internal rotation isometric. So with that same band with your elbow bent at 90, place a washcloth between your elbow and your rib cage. Using your shoulder joint, rotate your arm internally and hold to tolerance. Work up to 2 sets for 30 seconds each. So for the pushing, the first level is the wall push-up. Stand against the wall with your feet relatively close. Place your hands on the wall, lower yourself down, and press yourself away. Slightly move your feet away a little bit more to increase the difficulty. The knee push-up, level 2. Swaying on the floor, place your hands on the floor and lift your toes off the ground. In a knee plank position, press yourself up off the floor and down to tolerance. Increase range of motion as tolerated. Level 3, bench push-up. Using a bench or a step with your feet on the ground, place your hands on the bench. Press up to tolerance and then lower to the starting position. Increase the range of motion and reps as tolerated. Level 4 or normal push-up. Swaying on the ground with your toes on the ground and your hands on the ground. Get into a normal push-up position. Press off the floor and return to the starting position. Increase range of motion and reps as tolerated. Pulling, level 1. With a lightweight resistance band, anchor one end and grab one end with the affected shoulder. Using your arm, pull towards your chest and then return to the starting position. You may need to step away or step closer to increase or decrease the difficulty. Work in terms of range of motion and reps. Level 2, use a more stiff resistance band and repeat the same motion as the previous exercise. And again, working on increasing range of motion and reps as your symptoms allow. Level 3, in a more flexed or bent position. So bringing your arm up between 45 and 90 degrees and then pulling down towards the shoulder from that position, maintaining that angle, and increase reps and range of motions as your symptoms allow. Level 4, trying to get that arm all the way up into 180 degrees or completely overhead, and then pull down more like a lat pull down or a pull up. Again, trying to keep your arm fully straight at the shoulder joint. And then again, increase range of motion and reps as your symptoms allow. Level 1, with an extremely lightweight dumbbell, keeping your elbow straight, raise your arm up forward to 70 degrees and then return to the starting position. Again, only go up to 70 degrees and increase the reps as your symptoms allow. Level 2, overhead lifting with a slightly bent elbow. So bend your elbow about 30 degrees with that lightweight dumbbell and raise your hand all the way overhead and then down. But again, make sure to keep your elbow slightly bent to the full range of motion and increase the reps as your symptoms allow. Level 3, full arm raise overhead with your elbow straight. So that lightweight dumbbell with your elbow fully straight or extended, raise your arm all the way overhead and then return to the starting position. With this exercise, we want to increase weight as your symptoms allow. Rotation level 1. So at the bench, about the same height as your shoulder, put your arm over the affected arm with your elbow bent at 90. With a light weight, using our shoulder, we're going to rotate the dumbbell up towards the ceiling and then return to the starting motion. Reduce range of motion if you need, but increase range of motion and the weight and reps as your symptoms allow. Level 2, with the affected shoulder up and your elbow bent at 90, keep that same lightweight dumbbell. And then using your shoulder joint, we're going to rotate through the shoulder, up towards the ceiling, and then back down to the starting position. Make sure to keep your elbow pinned to your side at all times. And again, increase reps and weight as your symptoms allow. Level 3, rotation. So with your elbow on the affected side up, we're going to take that lightweight dumbbell and put our arm straight out with your elbow fully extended, and then swing our arm up towards the ceiling and rotate our arm or our thumb externally, and then return to the starting position. Again, you should feel tension over the posterior shoulder, and this is level 3, so it's quite challenging, so make sure to get comfortable with the level 2 before progressing to this one. Keep the elbow straight through the whole range of motion. Now we're going to talk about what's the difference between a minor tear and a major tear. You may get an MRI report that says you have a major tear of your rotator cuff, but what does that actually mean? This consensus found that the retraction of the tendon or sheath that we talked about earlier has to be enough where 60% or more of the greater tuberosity is exposed of the humeral head to be considered a major tear. And if you have a tear, what is the likelihood that it's going to get worse or progress over time? This paper found that people with tears of greater than 5 millimeters identified by ultrasound or MRI, in people with or without shoulder pain, the tears progressed at a similar rate between the groups, and at 2.5-year follow-up, the progress was not significant in terms of progress of tears. However, if the tear does increase, you're 5 times more likely to have pain than if it doesn't. And pain is multifactorial and complex, so this paper found that mental health was more correlated to people's pain than the rotator cuff tear size. So again, you have to give the whole person here, not just one part of the body. Now we're going to talk about when is surgery needed. This paper compared 2 groups, surgery versus PT, and at 1-year follow-up they found no significant difference between pain and function between the 2 groups. And this collaborated with this other paper that had 3 different groups, and again they found no significant change between the 2 surgery groups and the control group. It also appears that there's no age cutoff, so it doesn't seem like people over the age of 65 should have surgery, and it also doesn't appear that persistent pains in terms of how long you've had the pain indicate surgery or not. But the things that we do know for surgery is if you've had a traumatic fall or dislocation, sudden or profound muscle weakness, then that indicates more likely that there's been a traumatic tear and surgery is warranted. Thank you for watching our video on rotator cuff tears. We hope you found it educational and helpful. If you did, please like our video and subscribe to our channel, and don't forget to check out our other videos.